Hey, this is Gary Orris coming at you again with another second opinion. But before I get started on that, I wanted to go back to the supplements again. Just saw a commercial with a patch that you put on, and it almost instantaneously interferes with signals of nerve pain and it relieves it. And here is a picture that was shown on television, which I didn't catch, my daughter did. The patch is actually on this guy's prosthesis. It's not even attached to his body. And they're trying to tell us that will stop pain? Come on, guys, we're not that stupid. So now we're going to go on, we're going to talk about statins. That's today's topic. Right up front, I don't like statins, never have. I try to avoid putting anybody on them. I am in the minority. Most doctors and especially cardiologists promote it and promote it heavily. The problem with statins, the true disease process which has been shown is inflammation in the coronary vessels. So if that's the case, high cholesterol is not the disease, it's a symptom. So when we treat someone with a statin, we're treating a symptom, not the disease. We need to treat the disease. So logically, it doesn't make sense that we're doing this. Thinking that we can lower your LDL cholesterol to prevent plaque when it's not the problem just doesn't make sense. It's not true. There was a study of 140,000 patients that were not on a statin that had a heart attack. Yep, half of that group already had low cholesterol. There is no correlation between high cholesterol and heart disease. There's very little evidence to support that statins do anything to the primary prevention of a heart attack or a stroke. The benefit of a statin is really measured around 1 to 2%. The National Institute of Clinical Excellence even admits that 140 low-risk patients have to take a statin for 5 years to prevent one heart attack. They also showed if a patient had a heart attack, now they become a high-risk patient, the statin only has a 1 in 40 chance of preventing a second heart attack. And that, not just that, but statins are shown to enable only a 1 in 83 chance of prolonging your life. So how did this happen? Where did the controversy come from? Well, that's simple. The research was done by the pharmaceutical company, and they pick and choose research results to get the means that they want, to get the result that they want, and they'll alter and twist the results and make it a relative risk versus an absolute risk. John Ioannidis, who is a clinical professor, a doctor at Stanford Medical School, stated, most medical research is at the very least misleading, if not false. Evidence does show that statins will lower the cholesterol, but the real world data shows they have absolutely no effect on either overall deaths or rates of serious illness. Over the past 30 years, the promotion of cholesterol with statins has led to an increase in heart disease. If statins were really working, heart disease should have gone down. So what are the downsides of statins? What are their side effects? It's not a benign chemical. That's what I don't like about them. 10 to 40% of the time, a patient will have a side effect from a statin. Muscle aching, fatigue, headache, liver or kidney failure, dementia, damage to bone marrow, and diabetes. Remember when I said 1 in 140 low-risk patients will benefit from a statin? Well, 1 in 100 patients on a statin will develop diabetes. Cholesterol is treated like the evil villain here. Well, it's not. We need cholesterol. It's vital. We need cholesterol to make testosterone and estrogen. We need cholesterol to carry fat-soluble vitamins through the bloodstream. A 2012 study in Britain and the US showed that prescribed medications, especially prescribing too many medications, which is what the pharmaceutical company wants, that is the third leading cause of death behind heart attacks and cancer. All right, so what do we do to try to prevent a heart attack, which is what we want to do other than use statins? First, we have to understand what's really going on. Like I said earlier, the disease process is inflammation at the coronary vessels. Inflammation and oxidative stress is what leads to damage to the vessels, and then the LDL cholesterol is brought in to treat the damage, and that's where the plaque starts building up. It doesn't matter how much LDL there is, it's going to pull it out of the bloodstream, whatever's there, if it's high or low, to try to repair the damage, and then plaque forms. So other things that we can do. Smoking, no question it increases oxidative stress and inflammation at the coronary vessels. Diabetes, will increase the inflammation of the coronary vessels. Now, diabetes is the reason it's so bad is glucose and fructose has been shown to be the real aggravant of the inflammation of the coronary vessels. And lowering glucose is what we really need to do to help promote it, healthy coronary vessels in the first place. So regular exercise, eating right, decreasing your carbohydrate intake. Fish oil is something else that you can take that's shown to decrease inflammation of the coronary vessels. But make sure you take, when you look at the label, you want it to have high concentrations of EPA and DHA. Those are the two fatty acids that have been shown to be beneficial. If it's got low concentrations in those, put it back and go and look for another one. The Mediterranean diet has been shown to be beneficial. Don't know if I could do it. I try to lean towards that concept, which is mainly fish, a little bit of red meat, olive oil, fruits, vegetables, that kind of thing. But getting rid of that belly fat, that excess weight, and just any kind of regular exercise. You don't have to do anything crazy, just get out walking. These are the things that we need to do to prevent heart disease. So in summary, I'm basically giving my second opinion on statins, and that I don't like them, and I try my best to avoid putting people on them, and I love to try to take them back off if I can, if they're already on them, and just see. Like I said, if that LDL is less than 180, then I'm going to do my best to get you off of it, because I just feel like I'm doing you harm. I will never take a statin. I can go back 3 generations, and there are no heart attacks in my family. And genetics, which I think I did stress, is a big player here. So the bottom line, look at yourself. If you've not had a heart attack, do you really need to be on a statin? I'll be glad to talk to you about it if you want to come in and discuss the risk there. But no evidence supports taking a statin is going to help prevent a heart attack. You know, I think in America we get caught up. I want to eat that hamburger. I want to eat those French fries, so therefore I need to take a statin to help it. That's the wrong attitude. This is Gary Orris with a Statin Second Opinion. Thank you.